is available later. I am recording. All right. I am Dr. Jasmine Clark. I am the state representative for Georgia's House District 108. Many of you are aware of that. I cover the city of Lilburn and surrounding areas of Norcross, Tucker, Stone Mountain, and Lawrenceville currently. I, along with being a state representative, am also a microbiology lecturer. And so because we are talking about microbiology and talking about microbes, I couldn't help myself. And I made a very, very short presentation of what monkeypox is, and then we'll go straight into your questions. And so let's start with what is monkeypox. It's a virus. It's in the Poxviridae family, and another virus that you may have heard of that is also in this family is smallpox. Now, even though chickenpox has the word pox in it, or the word pox in the name, it is not the same as chickenpox. They're in a different virus family. So we are looking at a virus that is a cousin of smallpox, but not really related to chickenpox. So how is it spread? A lot of this, it can be found on the CDC's website, but I went ahead and did some homework for you and wanted to give you this, information. Pretty much monkeypox is spread through close, intimate contact. That contact can be through touching, hugging, kissing, massaging, any type of sexual contact. It can also be spread through bedding, towels, surfaces, and objects that might be shared during intimacy. There is also some evidence that some respiratory secretions can cause the spread of monkeypox, but it requires prolonged, and I put prolonged in bold, prolonged face-to-face contact in order for that type of spread to occur. And also the CDC also reports that it can spread from mother to fetus through the placenta during pregnancy. So signs and symptoms, it's going to present as a rash, and that rash is going to be a bunch of bumps that look like blisters, and they can be anywhere on the body, but we're usually seeing them in the genital area, the anal area, hands, feet, and face, but really that it's not limited to those areas. It can also be accompanied by flu symptoms, and the key word to that is can. It is not always accompanied by flu-like symptoms, and sometimes some individuals present with flu-like symptoms first and then get a rash, and sometimes people get a rash and then get flu-like symptoms along with that rash. So, it kind of presents differently in different people, but overall, the main symptom that we see are these blisters all over the body. The good news is there is both treatment and vaccines for monkeypox. Generally speaking, monkeypox is not very fatal, and monkeypox, although it is spreading, it is still quite rare. Most people do not need antivirals. That would probably only be given in the case of someone who's severely immunocompromised. And there is a vaccine available, but right now, because of limited supply, that's really limited to people who are at risk, at high risk. And I hope Dr. Arona will expound on that. Without treatment, most individuals will be able, the virus will resolve on its own in about 2 to 4 weeks. You are still contagious until every blister has closed and a new layer of skin has formed. So that's also really important. And as I promised, it was going to be very short. And the point of tonight's town hall is to answer community questions. So I'm going to stop my share and bring it back to you, Dr. Arona. All right, so are you ready? This is like a rapid fire type of Q&A.
Yeah. Absolutely. Right. If I could just say a couple things before we get started, because
Absolutely.
it may end up alleviating a lot of questions or answering some of the questions in the meantime. Thank you so much for that great overview. That was really, really perfect. And that's the epidemiology in you, right? You're so great. But I do want everyone to know that the transmission, we have not seen transmission in a school setting. So to my knowledge, every single case that's been in a female and a child in the United States has been linked to a household contact. So that is really, really important because, when you look at kids who are positive and parents receiving these contact letters and, oh, there's a monkeypox case in the school, everyone worries that there's transmission within the school. And we have not seen that. We have not seen transmission of monkeypox in the general community as well. So that's really important to know because really the risk in the general community for the transmission of monkeypox is extremely low. Where we see monkeypox transmission is, like you said, in those prolonged skin-to-skin contact, primarily in adults, that occurs in the household setting. And so that's really important. And one thing too that you all should know is that even within the healthcare profession, we have not seen transmission even among the healthcare providers that are testing patients and swabbing patients with the monkeypox lesions. And so that's really important too, because if anything, those people would be the most at risk because they're actually, exposed to patients with monkeypox. So that's really important. And like you said, chickenpox is not related to monkeypox. The word pox means that you have a rash that has vesicles, which are like fluid-filled or containing blisters type of thing. So smallpox is similar to that. Chickenpox has those types of things. But again, they're not related, like you said. It's important to know that monkeypox is really not even classified, even as today, as an STD, a sexually transmitted disease. And that's important because even though most of the monkeypox transmission we're seeing is sexually transmitted right now amongst that population of, the men who have sex with men, that's basically the population we're seeing this in. It's not classified as an STD or a sexually transmitted disease. It is classified as sexually transmissible, which is really important for you to understand that. And the real key, like you said, is that word prolonged, which I'm glad you highlighted that, Representative, because really it's the prolonged skin-to-skin contact of the actual blisters that is where we're seeing the transmission. One more thing is that with this outbreak, what's really important is that this version of monkeypox, unlike some of the other monkeypox versions we've seen or the strains that we've seen in Africa and other countries, more where monkeypox is more endemic, this outbreak that we're seeing is not characteristic of that flu-like syndrome symptoms that we see. We see more of the rash and that type of thing, but we're not seeing those prodromal symptoms of flu-like symptoms so much in this particular outbreak, which is really important because it's, and that's actually good because what that means is that, the rash is probably what's going to bring people to, be tested and diagnosed instead. There has been one death, to be completely transparent. There is a death that was reported in Texas. That would be the first monkeypox related death if they determine that that death was in fact associated with monkeypox. It wasn't a person that had monkeypox, but that person also had a lot of other immunocompromising conditions. And so until those autopsies and everything are gone, I just wanted to address that with the group because I'm sure that some people have read that on the news or heard it on the news. And to be completely transparent, we're waiting to see, what that's about. The other deaths that have been reported in other countries are essentially due to, the severity of the disease and the lack of adequate health care that is pretty typical of some of those countries. The other thing I wanted to say is as of now, we at the end of May is really when we started to see this outbreak occur. And like you said, it's very rare. Monkeypox is not new. We've had this since 1958. But globally, we do have over 51,000 cases now, and 99 countries have those, 92 of which have never had monkeypox in there before. So you can see that, it's truly an outbreak, but it's not considered a pandemic because there's not global spread. It's just spread within continents that we're seeing. The United States, as of this evening, has almost 19,000 cases, and Georgia has a little over 1,400 cases. Georgia is number 5 in the nation for the numbers. And I think if you look at the states that have really large cities where a lot of these gay and bisexual gay pride events occur. That's where we're seeing those. So Illinois is Chicago. The first is California, of course, then New York, Florida because of Miami, of course, Georgia because of Atlanta, and Texas as well. So the United States is the country within the world, within global, that has the most cases right now. Globally, like I said, there's 51,000, and following us is Spain, which to our near 19,000, Spain has 6,500 cases. So again, the United States is the one with the most cases. So I'll stop there and just see what questions you might have. Thank you.
Awesome. Yes. Actually, your ending was perfect for the beginning of the next part or the first question. And that question was basically, from what I understand from the news, this virus only affects men that have sex with men. I kind of paraphrase that. So if I do not fit in that category, do I have any risk at all?
That is just really a great question. And I'll answer that by saying that, remember, the primary mode of transmission is within an adult population where there is prolonged skin-to-skin transmission or contact with somebody with monkeypox lesions. So again, we're seeing that basically in the gay and bisexual community primarily. Remember, though, that there are a lot of households that have children and women that live in those homes. And so the reason we're seeing this, and we're not it's not unpredicted. I mean, we predicted that we would see this in women and children, because there are households where monkeypox is present, and with women and children who live there, who share linens, who share maybe some towels, different types of things on surfaces, prolonged surfaces, that type of thing, and skin to skin contact, because, we hold children, right? And so again, the important thing is that the awareness and the education that's becoming, so prevalent in our community, and much more so since this outbreak began, that most of those cases are now being isolated, and there is education being pushed out as what to do with linens and towels and that type of thing. And what's really, really super great about this, Representative Clark, is that this is not a very hardy virus. It's not like COVID. So you don't need special cleaning products. You can wash linens and towels in hot water and normal soap, and you'll destroy the virus. And so it's really good. And on commonly touched surfaces, the regular household products that we have work really, really well against this virus.
Awesome. Yes. Thank you so much for that. And actually, that's the perfect segue to the next question that I have. One person asked, what is the reproductive rate of monkeypox, and how does that compare to the reproductive rate of the current variant of COVID? So you brought up how it's not as sturdy as COVID, but what about its ability to, infect or spread, or what we know as the R naught for this virus?
Yeah, great question, and one I haven't encountered before. So how about that? I don't know the R naught, but the R naught is typically associated with respiratory transmission of viruses like COVID. We know that we compare that to influenza and different types of respiratory viruses. What we do know about monkeypox is that even though the CDC lists or defines close contacts as those people that are within 6 feet of an infected case for 3 hours or more, okay, we know that the transmission of monkeypox in that particular setting is extremely low, and that's a very, very high precaution that, frankly, I'm not really sure that that definition should exist, but in any event, it does exist. And that's why some parents are getting letters from the schools and different things if your child were to fit that category where they've been within 6 feet for more than 3 hours, 3 or more hours within somebody infected. But remember that, basically what we're seeing in terms of respiratory transmission is, like you said earlier, it's that prolonged, very close, almost kissing relationship from respiratory. And those cases that we've seen in the United States that we think are respiratory linked are due to patients who have monkeypox lesions within their oral cavity, within their mouth.
All right, thank you. Yeah, that's very, very helpful because I know a lot of people are like, do I need to start wearing masks, or, like, what is the risk if I got this letter? Does my child need to isolate? Those are things that are concerning to some people. All right, you kind of brought it up, but just in case people missed it, what exactly is the definition of a close contact for monkeypox? And you kind of just answered it, but just in case people missed it, want to make sure we get that question answered.
Well, yes, and I answered it in terms of respiratory transmission, like in a school setting or so, but actually the definition of a close contact is any household contacts of a person that's diagnosed with monkeypox infection. So what we do is we reach out to any person that would live in the home that could potentially have, contact with surfaces or linens or towels or different things like that. The good news is, like you mentioned earlier, is that we have a vaccine that we're giving. And so, basically there's several indicators to give the vaccine to some people. But as terms of contacts, what we're doing is we're giving prophylaxis vaccine to household contacts of somebody that is exposed to, or somebody that has diagnosed confirmed monkeypox within the home. So after we talk about the exposure and different stuff, a lot of people elect not to get the monkeypox vaccine, even if they're a household contact. But we're giving it, fortunately, it's under emergency use authorization to use even in children under the age of 18. And so we're giving it to infants and children and different things like that. If they have a household contact, we are offering that vaccine to them. But the good news is that, usually, again, what we're seeing in terms of, the definition, the clear definition of a contact is somebody that has a household contact or has been a partner of someone who's diagnosed with, confirmed monkeypox. So we're reaching out not just to household contacts, but also to partners, sexual partners, and people that have been, skin to skin potential contact, prolonged contact with these patients as well.
Gotcha. So that's, I guess, what a lot of people would consider contact tracing, where you are contacting anyone that might have common contact with the person, especially in the household, is what I'm hearing. Awesome. All right. So I feel like you've answered this as well, but again, just want to make sure that we get this information out. So what do schools need to do specifically to keep people in the school safe if there is a case in their school? And you already said it, that close contacts do not need to stay home or isolate if you get that letter. But outside of not isolating, like, what do close contacts need to do? And what do schools need to do to prevent or continue this trend where we're not seeing transmission in the schools?
Right. Very, very good question. So first of all, if you get a letter from the school, there's going to be 2 letters that go out when there's a confirmed case of monkeypox in the school setting. And one is going to be a letter to everyone saying, hey, there's been a person diagnosed with monkeypox within the school setting. And then it'll go through details in terms of, if you didn't receive a letter saying your child was directly exposed, then this is what you do and all that. So I would really recommend that you follow the guidelines, which, Gwinnett County Public Schools is so awesome because they partner with us and they make sure that letters that go out are approved language from the health department and the state office as well. And so, because we don't want to confuse people, we want to make sure that adequate information gets out. And so I just love Gwinnett County Public Schools because they do that so well. And Rockdale and Newton do too. So I'm really pleased with that. But basically what will happen is if your child was exposed and you get that contact letter saying, your child has been exposed to monkeypox, it gives you a very detailed list of what to look for the next 21 days, right? And your child can still go to school. Your child you can still go to work. You can still do sports. It's not like COVID with this quarantine, stuff where, those people who are exposed have to worry about coming down with it. This is not, if your child is going to get monkeypox, you will know it based on these symptoms. So they give you a very detailed list of what to look for. Okay. And of course, the schools, are sanitizing every day because of COVID anyway. But what the schools would do is then, just make it clear to all the parents that they are going to be certain that all the surfaces are cleaned and different things like that, just to reassure patients that, or parents that the school is safe to return their children to, right? And so the other things that parents can do is, of course, just, watch kids for symptoms, rash. As you well know, Representative Clark, kids have rashes all the time, right? And so it's really scary at this particular time. They get a bug bite and you go, oh my goodness, what is that? And so, this monkeypox outbreak has really caused a lot of high alert, anxiety with some parents and even kids themselves, right? So we have to put all of our fear in perspective and realize that the transmission within school is really, really super low. And if you have a person within your home that is gay, bisexual, has monkeypox or none, even in those situations, you can clearly contain the infection, isolate those those people, wash surfaces, wash linens indifferently, like we talked about. And it's really not as difficult as you might think. And the good news is that our numbers are declining. The world, globally, we're seeing numbers of monkeypox decline, and we're seeing numbers in the United States decline as well.
Well, that is certainly good news. I think after 2 years of COVID, over 2 years of COVID, and, just being on high alert for things like that, it's nice to see that it sounds like we're on the down slope of this month of monkeypox. And I also want to commend, I don't know if it was Gwinnett County, but I know that overall, when we compare the availability of vaccines and who's getting vaccinated, Georgia has actually been shown to be more equitable, although there's still a lot of work to do. I want to be clear on that, but more equitable than a lot of other states in making sure that the people who are most affected are the people that also have access to the vaccine. I want to point out that for some reason, although I can see the live and you probably can see the live, I don't think the live is actually showing, because when I try to open it on another browser, it's not there. And so I know. So this will be, it has been recorded, and it also will show up on my Facebook page later. So all this information is still very pertinent, but that means we don't have any extra questions at the moment because the technical difficulties. But I wanted to go ahead and close this out. I wanted this to be short and sweet and answer the concerns of the community. But I also, before we got on, you also had an update on COVID. And so I wanted to go ahead and give you an opportunity, give you the floor to briefly talk about the new news when it comes to COVID variant boosters. Oh, and polio too.
Yes, and thank you for letting me do that, because I just really feel like the more accurate information we get, the soonest we can to our population communities, the better. And so the good news is our COVID cases over the last couple of weeks has actually been declining, right? We were up to 3,600 a day, and now we're down in Georgia to 3,000 a day. So it's decreasing, which is really good. 90% or more nationally and in Georgia are due to this BA.5, which is the most recent Omicron variant, which is more transmissible, but we're seeing it less severe disease. So the one thing I like to tell everybody is that COVID is responding like a normal virus, where the virus has become more transmissible over time and less deadly. And that makes sense from a virus standpoint because viruses want to reproduce. Okay. And so if it kills its host, that host can't reproduce, right? So typically, as you well know, that the viruses over time will become more transmissible and easier to infect each other with, but less deadly. And so that's what we're seeing. But I don't want anyone to really think that we're out of the woods with COVID, because COVID is still a different animal. It causes a lot more illness than even influenza. And we have the fall coming where the colder temperatures coming in, people are going to gather more indoors. So we just have to be really careful about spreading COVID when we don't have to. So please keep your hands washed. And, if you don't feel well, stay home from work, all that. But the good news is that we do have a new, what they call a bivalent booster that was approved by the FDA last week. The ACIP committee, which is the immunizations committee at the CDC for immunization practices that has to approve these types of things before we use them, they approved it today, and the CDC should follow suit within the next 24 to 48 hours. So we could have this booster available as soon as next week. There's a couple really important things to know about this. First of all, it is an mRNA booster, and Moderna and Pfizer have both been approved. Moderna is only going to be approved, the booster, for 18 and older, okay, for this new bivalent booster. Pfizer's bivalent booster will be available for 12 and older. What's important to know is that as of today, they are no longer giving boosters of the old vaccine or the old booster. So nobody, if you walked into a health center today, you can't get the booster if you were say, oh, I had, I had COVID a couple months ago and I want my second booster now, if you're over 50, or if you just say, okay, I've had my primary series and I've had 2 doses, but I want a booster, you can't get it right now. So they took those away. So they stopped the emergency use authorization for the mRNA, Pfizer and Moderna to be used as a booster. So the only booster that people will be able to get is this new bivalent booster, and it is Omicron adapted. Okay. So the other important thing to know is that if you've had a recent booster, whether you're over 50 or immunocompromised and you got the second booster, or whether you got the first booster, you have to be 2 months after that in order to get this new booster. So if we get it out next week, it'll be after, July, before you can qualify for that. The other most important thing, Representative, that I really need you to help me share with everyone is that if you are unvaccinated and you decided you want to get this bivalent booster, you can't get it. Only the people who, if you're unvaccinated, you have to go back and get the first 2 vaccines in the series first, and then you'll qualify 2 months after that to get the booster. So those are some really important things. The other thing I wanted to make sure everybody knew about is that we do have a new vaccine called Novavax, which is a more traditionally made protein subunit vaccine. So those people who have been really hesitant to get the mRNA because of the new technology and just they don't have confidence in that whole situation, we do now have a COVID vaccine called Novavax, which is available, that's more traditionally made. So hopefully we'll get more people in Georgia vaccinated. We're still in Gwinnett County, we're only 62% fully vaccinated. So we still have a long way to go. Overall in Georgia, overall population is 57% vaccinated. So again, we need to really encourage those vaccinations.
Oh my gosh, I didn't realize our numbers were so low. It seems like after this much time, it would be higher. So I do have a question from Kurt Yemens from Gwinnett Daily Post. He wants to know, will there be any mass monkeypox monkeypox vaccination events in Gwinnett, Newton, or Rockdale?
Great question, Kurt. And we already did a mass vaccination event. Let's see, 3 weeks ago. We had 3,000 appointments over 2 days. We did a drive-through at the Sears location at Gwinnett Place Mall. We had a few no-shows for that, but we have second dose appointments for those individuals scheduled already for September 9 and 10, which will be next weekend. And that will be at the Gwinnett Place Mall Sears location as well. What I can tell you is that initially the vaccine, when we rolled it out, we had huge numbers of people trying to get those vaccines. Kind of reminded us of COVID vaccines at the very beginning. But what we've seen now is that we've kind of caught up to that demand, because we have open appointments even for next week, and in our health centers and in our district office on the state scheduling system. So we really have caught up, it seems, to the demand. So there really is not a problem for patients or people to get the vaccine or sign up for it right now.
Awesome. And a follow-up question, he was just wondering, could you talk about what we are seeing in GNR seeing in GNR's footprint in terms of the number of monkeypox cases in our region, so the Gwinnett, Newton, Rockdale area? Like, where do we stand, I guess, based on case numbers, or I don't know if you have that information, but yeah, can you expound?
Yes, I surely can. And, we're not releasing county statistics in terms of, cases and different things. But what I can tell you is that the majority of the people that we're vaccinating and the most of the cases that we're seeing are in other counties other than Gwinnett. So in our district, which is Gwinnett, Newton, and Rockdale, I can tell you that we have less than 120 cases total. Most of those, of course, are in Gwinnett County. Because we're more populous, of course, but as it compares to the overall state numbers, most of those cases are in Fulton and DeKalb counties.
Great. Thank you so much for addressing those questions. And I want to just give you an opportunity to provide any closing remarks before we close out for the evening. And as I said, this will actually go up. I'm not sure what happened here, but this will go up. It will be available for people to ask questions. If there are follow-up questions, I might just email you and, ask you those questions. But any closing remarks for this evening?
Yes, absolutely. And thank you so much. And you're free to text me, email me anytime. You and I work so well together. It's great to have, your expertise and your background represented. Makes a big difference and makes my job easier because the questions to ask. And so I love our partnership, which is really great. The other thing that I would just mention to all parents and people that are on this Zoom meeting is that, we really, really need to watch. Monkeypox is going to go away. It's an outbreak, but it's already, the cases are starting to decrease. This is a typical public health response. When we see an outbreak like this and we manage transmission and try to get education out and provide vaccine and treatment if we can. But again, that's kind of short term. What worries me more than monkeypox and worries me more right now than COVID is polio. Because we've seen a case of the vaccine-derived transmission of polio in New York City. And, only, from what I've been told, only 65% of the children in the United States are vaccinated against polio, which is really crazy. This is 100% preventable. And one case, polio is so devastating. All you have to do is really look up the history of polio. We cannot allow our country to go back to having cases of polio. And we literally are a plane ride away to New York City for transmission. So I would encourage parents, even if they're a little bit questionable about vaccines in general, do not miss the opportunity to get your child vaccinated for polio. This is just too important. And we're seeing, I'm worried that we're going to start seeing more cases in the United States.
I oftentimes teach history in my microbiology class because I always find it so fascinating how new the field of microbiology is. And one of the things we talk about is how new certain vaccines are and how there are people who are alive today, some of them actually in leadership positions, who were alive before we had access to vaccinations to things like polio. And so the effects of seeing polio spread through the community were devastating back then. And when the vaccine came out, it was, it was a godsend. People were very happy that they had a way to stop a very debilitating disease. And so I share your concerns that we need to do all that we can to not have a polio outbreak, especially something that had been, quote, eradicated for the most part. And so I hope that we can all make sure that we do all that we can. And hopefully, healthcare systems, physicians, things like that can make sure when people come in for those checkups, make sure that they are vaccinated. And if not, get people vaccinated so we don't see a resurgence of polio or emergence of polio in the United States or anywhere else in the world. All right. Well, thank you so much, Dr. Arona, for joining me this evening. As you said, it's always a pleasure to work with you and do all that we can to protect the public health of the people here in Gwinnett County. I'm partial to Gwinnett. I know you work in 2 other counties as well, but here in Gwinnett County, I'm really appreciative of your willingness to always engage and to answer questions whenever I ask. And so with that, you have anything else?
No, ma'am, it's great. Thank you so much for having me.
Thank you so much to the media who also joined us as well. Everyone have a great evening. And the live stream has stopped. All right, so I do not know, I'm gonna stop